was diagnosed, like so many kidney cancer patients, after a long misdiagnosis. And this misdiagnosis, in my case, was an assumption that I had a stomach ulcer that gave me severe anemia, and I was treated for the anemia and the stomach ulcer. The stomach ulcer was non-existent, I determined after I saw the pathology. But 8 months passed from the first time I saw a doctor about this anemia until the kidney cancer was diagnosed. And it was not one of those small 7 centimeter and under, it was 10 centimeters, which is essentially, bigger than my fist, the size of a softball. So I went from searching for a reason for the anemia to finding out I had a kidney cancer. I wasn't even able to understand enough to ask how big the mass was. And so it was a stunner. It was shocking beyond belief to find out it was as large as it was. Worse yet, a CAT scan some days earlier had shown that I did have metastases in my lungs, but my subsequent follow-up showed it was throughout my lungs, and there were hundreds of them. So the moment I really had a diagnosis, it seemed to expand and expand to a worse diagnosis. And frankly, that's a kind of a typical kidney cancer story for so many. So I was fortunate in that I went to a distant clinic, and by sheer luck, was able to find a urologist who was also a kidney cancer researcher. That's pretty unusual. And it was he who guided me to return back to the LA area, where I did go through this high-dose interleukin treatment, which required my being in a hospital, a total of 4 weeks spread out over about 2.5 months. This revved up my immune system by replicating what your body does when you have any immune response, but over and over again until my metastases were cleared. And that was now almost exactly 12 years ago. And since that time, I have not taken a single medication to fight the kidney cancer. I haven't needed to. And it was the realization that, number one, I was just pure lucky to know to go to find and seek out this specialist, and to respond to a medication that few people used and not that many patients respond to. Since this time, and now again 12 years, there's been a tremendous increase in research on kidney cancer, on access to treatments that were previously in trial, and that continues. And along with this, an understanding that different people with the same disease will respond in different ways to the medications. Probably a lot of this is that there are subsets of the disease, and each patient brings a set of genetic shifts in their system, mutations for the most part, and how the meds interact with those mutations that led to the growth of the tumor. This is necessary to be refined patient by patient. And we see that starting to happen now, as it's been happening, for example, in breast cancer. But at this point, treatment for kidney cancer is somewhat of a guessing game, starting best with an understanding, again, of what kidney cancer you have, how far it's developed throughout your system, what the options are, what kind of medications you could take, with the kind of side effects that might result, and how they will affect your quality of life, or indeed your life. For example, the medication I had would not be appropriate for somebody who has an autoimmune disease, because it would set a cascade of problems. Someone else couldn't take another drug because they would be suspect to be getting something called pneumonitis, a non-infectious pneumonia. So there's, again, goes back to the expertise that is required and is being developed, but the newly diagnosed patient really needs to seek out that expertise and be willing to learn. And that's what I and a lot of other patients do, is to try to share our knowledge, what we've learned, might be just knowing which questions to ask and when to find another doctor, get a second opinion. that's what I do, and that's my way of saying thank you to the universe and all those people who worked to see that I was healthy again.